Okay, so today we're going to go over how to use the ETCo2 monitor. This would be the ETCo2 module, and if it doesn't happen to have one, you can go get a ETCo2 module, which, as you see, then you're going to just put that in the space, which is in the back. Don't put it in the front. It should just fit and snap in. If it doesn't just easily click in, don't just shove it in. Then it needs to have a water trap. Water traps need to be changed out between patients. This is what a water trap looks like. And we're going to put that, slide it in just like that. And you'll hear it click. There you go. Now, it will automatically come up on the monitor, if you can see that. Should at least. Now, this would be the end piece right here. That's the part that fits in right there. Now, if you look right here, you can see that it self-zeros when you put it in. It says it's the sensor is warming up, and you're getting a blank line all the way across instead of a little dotted line, meaning that your CO2 sensor is warming up and getting ready to go and zeroing itself out. So it says zeroing because you got to wait for it to warm up and for it to zero. Recovering. Then you should be ready to go. So go ahead and plug your right there. Then at this point, you should, as you can see, I'm breathing. Now, I kind of like these things to be the fill and not the draw, because that's kind of what everybody's used to looking at anyway. So, and as you can see, that's within normal range. It counts my respiratory rate. And now, you don't have to use the oxygen with it. You can use these and put an oxygen mask over. It does have ability to put oxygen at the one side right here. So if you were going to hook it to oxygen, you just hook it up the normal way. But you might need to change where it says right here, O2 compensation. So however much you want it to compensate. In this case, we're at 21% anyway, because we're at air, although 21% should be the same as 0. And that's in percentage, not in liters per minute. So you should be able to see that. You can hear it humming, and there's a green light on the module. And that's all there is to it. And then when you're done, you turn the parameter to off, so it just doesn't keep going and going and going. It's non-blood pressure. So if you see here, operating mode measure, operating mode standby, and that's it. And then when you take this off, you would take the water trap out for a new water trap in between patients. And you can put that back to standby, or you need to discharge the patient out of the system. So don't just put it on standby if you've been taking care of a patient, because if you do, all the data that was in there will be put into whoever the next person is. Hit discharge patient. You can hit print case report, because if you hit print case report, it will print out a summary of what your vital signs while they were there, and then you put discharge, and then it discharges them and puts it on standby, and it says discharged. So if anybody sees just plain standby, please go back in and discharge the patient or patients. Now,